Dr. Kristen Marks, thank you so much for joining me. Since you are the expert of women's hormones, I was hoping that you would be able to just go ahead and give me a little intro of your background.
Sure. Yeah. So I have been in conventional medicine, regular medicine, emergency medicine for 25 to 30 years now. Depends on how much you count residency or not. And several years ago, just kind of felt like, what am I missing? Why? I felt like we in general in conventional medicine are missing something. What are we missing? What, why do these people have these problems that we can't find the answers to? Why can't we fix them? We're looking, can't find answers. What are we missing? And I started just looking myself to try and figure that part out. And then I, went through menopause myself and, started with, I didn't have the hot flashes, which I was grateful for, but the brain fog, the sleep, the weight gain, all the other things, I'm just like not changing my weight, nothing like that. So I started getting all of those, and you ask for answers and nobody really has any good answers for you. Like how to, they're like, oh, well, you're just getting older. And I'm like, yeah, I'm not really good with that. So for two reasons, I kind of veered off into more functional medicine or integrative medicine and started looking at, bioidentical hormones and just gut health and, nutrition and all the things that go into being healthier and feeling better and helping your body transition through midlife.
Would it be fair to say it was more on the personal approach as to why you veered toward women's hormones because you were going through it?
Yeah, for sure. I mean, in the ER, you don't see as much of that, but you do see some stuff like you see women coming in with anxiety that's new and they don't know where it came from. And I've never been an anxious person. Absolutely hormonal, things like that. You see a lot of stuff we see in the ER is more gut related. So, stomach problems that people can't figure out what's wrong and the tests are are normal. Nothing's showing up. Well, you're just not looking at the right tests. So it's all, and it's not the fault of conventional medicine or the doctors. That's how we're trained. These are the tests that we have. This is how we were trained. And so you're taught to think a certain way and you have to think about things a different way. And functional medicine kind of goes that route.
So with your 25 years of ER medicine, would it be fair to say that, say a couple comes in because someone's going through a life cycle of menopause or perimenopause and the couple comes into the ER because they have no idea what's going on, or the husband doesn't understand what's going on with his wife, and they're finding themselves in an ER.
Yes.
Have you experienced that when you were working in the ER, and did you recognize maybe that it was tied into hormones?
Yes. Couple times, not as often, but a couple times. And I've had discussions with people about it, but it's, again, you're kind of limited in the ER with what you can do, but I did direct them. I'm like, look, here, here's the tests we can run in the ER. We will make sure that there's nothing wrong here. But here's what I think is actually going on. And I'm not going to be able to figure that out here. You'll have to see a functional medicine doctor in order to be able to evaluate that further and come up with essentially a better diagnosis. I said, but we'll look, I always tell them, I'm like, we'll look here, we'll make sure everything looks okay here and that we're not finding anything here. If things look normal here, then there's another route you need to go.
I don't think that many people think we're serious when we say that there are married couples that find themselves in the ER for these varying reasons. And
yep.
So you're here to confirm that this is true. This happens more frequently than we can imagine.
It happens. It's not as much as I see, heart attacks and belly pain and whatever else, but yeah, it happens.
But enough to be looking into further, I guess the 25 years that you were in ER, I guess how long has it been since you've expanded into the integrative medicine space?
About 3 years now.
And always focused on women's hormones?
That's been kind of more where I've been leaning, I look at everything. So if somebody can, very often they're intertwined, your nutrition and your gut health is very much integrated to your hormonal health too. You have to have both. And so I look at everything when I look at somebody, but I tend to work more with women because that's just been my preference. But, I've had guys come to me too, and they're about just with, weight gain or their gut or whatever else. And so we can work on those things too. So I understand all of it and I've learned all of it, but my preference is just working with women and hormones.
Well, in the weight gain with the men or women, I look forward to circling into that with experience of, the intermittent fasting as well. But if I may, I really want to start with sort of our kind of dopamine nation that we tend to live in these days in 2026. It's just, I stole that name. That is a book that is written by a great psychiatrist, but it's real with regards to the stress, the burnout, if you want to call it adrenal fatigue.
Yes.
So when women may come to you, let's focus on women if we can. Specifically, women come to you and they are feeling stressed. They say stress, whatever that means. Where do you start with testing, let's say, or where exactly do you start in your protocol to determine what it is?
Yeah, it depends on all their symptoms, what their symptoms are, and which way it kind of leads me. Whether it sounds more like their cortisol's dysregulated, because that's often what it is. Their sleep's messed up and their cortisol's off, or if it's more, weight gain and insulin resistance and they're sleeping fine. And so it really just depends on which kind of symptoms are predominant in order to see which direction I start first. Because I want to try and fix that first, whatever that is, to make them start feeling better.
Okay. Top 3 things that you would start someone who's coming to you and just saying, I don't feel well, and I'm of a particular age, 40s to 50s, 50s to 60s, whether it's perimenopause or menopause. What would be the top 3 areas that you would start in?
Yeah, sleep, your weight, and your diet. Those are the top three things, honestly. And then because those 3 things will kind of tell me, depending on the age, their hormones are either like already gone or they're heading a certain direction. But those 3 things help me a lot figure out where their hormones actually are.
Okay. I'd like to lead into when you go into a diagnostic test to see whether you're testing cortisol, whether you're monitoring their cortisol pattern to notice what's going on with their sleep. So We've had our previous conversations about the Dutch test. Do you also go in with the adrenal, cortisol, saliva? Which test do you go in for specifically focused on sleep, but also stress? It's sort of a combined approach, correct?
Right. I love the Dutch. That's probably my favorite to do because it gives so much information. It not only gives you your cortisol and the pattern with your cortisol, but it also tells you, it gives you your estrogen or your progesterone or your testosterone and all of those things, your levels, but it also tells you how you metabolize those. And so that's one of the things I really love about the Dutch test. You can get levels of estrogen and progesterone, and you can do a salivary test where you're testing 4 different times a day to kind of give you an idea of the cortisol levels. You can get those things and get levels. But I love the Dutch because I get the metabolism with it too, and I can see how your body's breaking it down. So it's just my preference for that reason.
So this is Precision Analytical. The Dutch test stands for Dried Urine Test for Comprehensive Hormones. For anyone doesn't know. Now, that's your go-to. That's your diagnostic test that you're looking at when it comes to hormones, sleep, stress levels. So could we take it back to the normal trap? Like the normal lab trap.
Yeah.
Being in the ER to where we are now, because it's always nice to touch on what the difference is. Not to go down the route of conventional, some people have to start somewhere, but where does that normal labs trap come from, and where do you go from that?
So a lot of times they're just testing a couple things when you're testing your normal labs. They might check a TSH, they might check, an estrogen, but that's all they're checking. I want all the different thyroid things. I want the T3 and the T4, and I want DHEA, and I want a fasting insulin. And because that, I think, goes off the rails before your sugar, even your hemoglobin A1C or your sugar starts getting crazy, your fasting insulin starts changing. And you can catch things so much earlier with that. Nobody looks at that, and then you get into the cortisol curve. So you need a couple tests for that. You can't just, if you do one, like your 8 a.m. cortisol, well, it might be great at 8 a.m., but that's not telling you why you have no energy at 2 p.m. It doesn't give you that information. And so you need more data rather than one or two tests. Your TSH might be completely normal, and your estrogen might look fine at whatever time of day or whatever period in your cycle that they checked it. But things change day to day, week to week. And, depending on the time of day, especially with your cortisol, everything changes. So you're just getting like a little picture in time, and they're like, oh, this is normal, but you don't feel normal. Well, your cortisol could be crashing in the middle of the afternoon, and it looks great at 8 a.m. So they're like, oh, this is great. It's not necessarily, because you haven't looked at all of it. So it's just not enough information, and not the right information always.
So we're speaking about the serum levels. That is, just
Correct.
Doesn't give you the full picture, but your approach is the dried urine, saliva, cortisol combined with giving you a better picture to see where we're at with their hormone levels.
Yes.
If I can dial it back a little bit to the hormone of the thyroid and the TSH levels. When it comes to hormones and balancing, the trifecta of hormones that are all connected, whether it be adrenals to the thyroid to the sex hormones, where do you, when it comes to what's provided in the diagnostic test that you run with Dutch, are you able to get a picture of the thyroid hormones much as you need?
Yeah, with the Dutch alone, no. But looking at how, looking at all the other pieces, will give you a little bit of a picture of the one piece that's missing, and give you an idea of whether it's off, whether it's okay, or whether you need to do more testing to look at that too. If you think of a puzzle, once you have all the different pieces in place, but you're missing the one, you can kind of tell what's supposed to go there, and so this piece over here, does that look like it fits there or not? And you can kind of make some judgments that way. But, ultimately, if you want to know all of that, then you add the thyroid panel in just to be certain. But you can figure out a whole lot without it.
Okay. Now, I want to make sure that people are able to see where to find you. And before I go there, whether it's via website, if you can just kind of mention what that website is, but can you give me a time frame of which, when someone comes into you initially, with even or without baseline labs, how much time do you try to share that this is going to be a process, and how long should they expect to be working with you to find a bit of a balance?
Several months, typically. Month one, oftentimes in month one, we're just making some changes without any labs even. I'm looking at them, I do an in-depth discussion with them, talk about what's going on in their lives, what medicines they're on, what health issues they have, and then all the things, sleep and hormones and all the stuff. And we start making some small changes just even in month one, and then we can get some lab work done and go back and start looking at that. And so it's probably before month two, before sometimes we can even address some of the underlying issues that we would find out with lab work. So it takes several months, and really a couple months before you really you'll start noticing a few changes within weeks, honestly, but to really kind of feel like, oh, I feel like myself again, it takes several months to really make all the needed changes and adjustments in order to get your body and your metabolism and everything back online.
That's fair. Do you find that a lot of your patients will see it all the way through?
Yes. Okay. Yeah, especially because they just start feeling better. Just even the small things that we can change, it's little tiny things that you can change, and you're like, oh, wow. Within weeks, usually by the time I see them the next time, like I can see a difference in their color. They feel better, their energy's better, and it's just small things, it's just simple stuff. And I can look at them and I'm like, oh my God, you look better. Like they just look better even, without even talking to them, I'm like, oh, they've got their color. Look at how good they look. It's just, it makes a huge difference. And so they feel better. And so they're like, okay, let's keep going. Let's get this situated.
So in mentioning earlier, that was a focus of trying to get experts such as yourself to help as many as we can understand how we can keep our stress at bay, how we can balance our hormones, how we can get a little bit more sleep. Where is the energy crisis? Let's say for example, there's an energy crisis because people are overwhelmed. That's where the stress, the frazzled, the overwhelmed feeling comes into play, whether you're a female going through life cycles of peri or post-menopause or menopause. There's this crash that comes, like the energy crash that comes in a slope of 2 p.m. in the afternoon. So do you address that at the beginning, or can you tackle that and give us any pointers now?
Yeah, that is almost never stress. It's almost always hormonal. Like perimenopause, you start having crazy cortisol swings. And when your cortisol drops mid-afternoon, your sugar drops with it. And like I was saying earlier, conventional medicine will miss that because they check your cortisol at 8 o'clock in the morning and it's great, but it's because of the changes and stuff like that. First thing you really have to do is get your blood sugar stable to help with that afternoon crash. And the one thing people will do is they don't eat protein in the morning. So you want to start fixing stuff right away, 25, 30 grams of protein in the morning. So whether that be eggs or some Greek yogurt, or, you can eat chicken or fish or whatever. I know it's not the typical breakfast, but, more protein in the morning to start your day off will keep your sugar more level and your insulin more level through the day. And you're not going to have that crash in the afternoon. And then you can do some like adaptogenic support too. Like they talk about ashwagandha and rhodiola. They're both really well researched for cortisol regulation. So that can help. And then sometimes it's just something simple, like it's a magnesium deficiency. And so those are just like a couple things, like, supplement with some magnesium, and then make sure you're eating protein in the morning, like changes things right away for people. That's what I mean. It's like sometimes it's just small changes that you can make, and it's not anything crazy or major, and you'll like immediately notice the effects within days.
I'm glad you mentioned the protein in the morning and the varied options, where I'm a fan of simple leftovers of protein from dinner the night before. Just
sure, yeah.
Eat it cold, heat it up, whatever your preference.
Right.
We're certainly going to get into the intermittent fasting because you're a big proponent of that.
Yes.
So when we get into the diets, for sure. So the afternoon energy wall as you said, is generally not even the energy, it's hormones. Rather,
right.
Did I say that correct?
Yep. Cortisol, insulin, your sugar, all that. Yep, absolutely.
So the diagnostic test to see that cortisol level, is that the CAR awakening response, where you see multiple points and the diurnal curve?
Right. You can do that. Like I said, that or the Dutch, something where you're getting multiple salivary samples throughout the day, like a morning, early afternoon, dinner time, nighttime. You're wanting different points through the day because that's going to show you the cortisol throughout the day. And you can see your curve is supposed to start out kind of in the morning, jumps up in the morning, and that's what wakes you up and gets you going. And it's supposed to kind of look like you go over the hill, like during the, get to the middle of your day and you're going over the hill, and then you're coming back down, and you slowly come down to the evening. And that's when everything settles down. You should go to bed. And so that's how it's supposed to look. But some people, have had, their cortisol, it looks like a little bumpy road. Some people, it's just flat. They've been so dysregulated for so long, their body's beyond stressed, and so can't even mount a normal cortisol response. So it just depends on where they are and how long they've been off, I guess.
So just to go ahead and confirm once again, the Dutch test, dried urine for the comprehensive hormones, and then we're speaking about the energy crisis comes and may derive from the cortisol, which is done diagnostically by saliva.
Correct.
So this is where many people think of, they go in and they use their labs, their serum labs, blood labs, serum, and that's where you're speaking about the 8 a.m. They see that it looks good at 8 a.m. and they only check that point by blood, and then that's it. And then they move on.
Right.
Okay.
Right.
Now, we've got to touch base on the caffeine. Because generally the caffeine crash, and this is not the cortisol curve, this is the caffeine crash.
Yes. Well, they use that as the crutch to fix that crash. They reach for carbs or they reach for caffeine when they crash like that. And that's, it's essentially just a crutch. It's kind of helping you like limp along, and doing caffeine, honestly, later in the afternoon doesn't help. It makes things worse. Because then by the time you should be getting ready to go to bed, you're not quite ready to go to bed. You might get a second wind, which you don't want at 9 o'clock at night. You want to be settling down for the night. And then you run into the same problem all over again. Your cortisol is going to be off all the next day. So that's another thing I tell people too. I'm like, depending on what their caffeine intake is, I'm like, okay, I said, you can have caffeine in the morning, but noon is it. You can't have any more afternoon. And usually that kind of holds them by making some changes that by the time it gets to be like 9 o'clock at night, they're like, oh, okay, I feel like I could go to bed now. Good. That's when you're supposed to,
Always circling to the diagnostic test. So do you get into the caffeine recommendations of the later times that they can have it if they're a slow or fast metabolizer? Do you get in the genetic testing to see if they process caffeine well?
I haven't yet.
Okay.
I know about it, but I have not gotten into all of that yet.
To each their own, whomever can give me any knowledge after getting the test done that I am a slow metabolizer and that I should not have more than 100 milligrams of caffeine. I surpass that by guaranteed 6, regardless of the time, even if it's before 9, that's... I'll look forward to touching base then. We should get into that, because that's also something where, okay, afternoon, no more. But when you are a slow metabolizer, even noon is so late.
Right, yeah.
So this leads to sleep. So let's say the window of 10 p.m. to 2 in the 4 hours of the best recovery. How would you speak to someone and guide them when they generally claim that they're a night owl? And their rhythm is that they go to sleep sometimes at 2, 3 in the morning.
Yeah, not healthy, especially if your job or work or whatever it is you're doing is daytime work. Like, definitely need to be in bed like no later than 10 o'clock. If you can get in bed earlier, that's great. But, I try to draw a hard line at 10 because it's hard, especially if you have kids and everything else going on. You're busy in the evening getting everybody settled, including yourself. So it takes a little while. But, 2 and 3 in the morning, you're just throwing your circadian rhythm completely off, and your cortisol is going to be all messed up because you're just completely off a cycle, and you're just not going to feel good. It's like you're not meant to function that way. So night shift people struggle with stuff like this for sure. It's just you're I don't know. It's harder for them because it's against kind of what our bodies are built to do.
Okay. Now, do we get into the green tea or the coffee, the type of coffee? Do you get to that nitty gritty?
I don't. Well, I talk about it if they want to talk about it, but I don't get it like mushroom coffee and all of that kind of stuff. It depends. Some people are struggling to give up their creamer. I'm like, you can't have creamer right now. I'm like, just for if they have issues with their gut or whatever, I'm like, can't have creamer right now. And they're like, oh my God. So they just, so I have to be, here's what we can do. So this is what we're going to do. If they want to know more about it, then we can talk about mushroom coffee and green tea and the benefits of those. But a lot of people just struggle. What do you mean I can't have 12 cups of coffee? So I work with what I can work with.
That is very fair. Meeting people where they're at is
right.
I think a very big lesson to learn. So whether it's sleep, whether it's all, I guess we could talk about the top reasons that people get brain fog. Again, back to the energy crisis, where they are not at their optimal performance. And it doesn't matter if they're high performing athletes or career oriented or caretakers and mothers. How do you dive into the brain fog and getting them past that to get to their peak optimal performance?
Yeah. So your brain fog is your estrogen. And I lived this. So I know this is, one of the things that drove me towards figuring out hormones. I'm in the ER and I couldn't remember medical terminology that I've used for 20 years. So I'm like, what was the word? What was the word? And I'm standing there trying to remember. And I'm like Googling like all the things around whatever the word is I'm trying to remember because I couldn't remember the word. And so I'm like, holy cow. And I've done it my whole life. Couldn't remember anything. So, and a lot of people will think it's burnout or it's anxiety and things like that. It's usually your estrogen. Your estrogen is so protective of your brain function. And so as that starts to decline, perimenopause, menopause, you start getting started some of the brain fog, and then to go along with it, you start, depending on your diet, if you've got some insulin resistance going on and your sugars are a little higher, the sugar is going to make your brain a little foggy too. Your brain actually functions better on ketones. So, just even having a little more glucose than you should floating around is going to make your head foggy too.
Interesting. Okay. I have not heard that. So bringing it to estrogens, there's a book, Estrogen Matters. And there's also the history of many people scared to take estrogen.
Yes.
For varying reasons, causing cancer, etc. Would you be able to speak to that as to how important it is, how you supplement, or how you actually recommend they intake their estrogen?
Yeah, it varies from person to person, and we kind of see which way works best for them too. Stuff by mouth tends to not work as well. So it's usually like something topical or, like a patch or a cream or something along those lines tends to work better. Estrogen by mouth tends to not really work. And most people will start noticing shifts pretty quickly after using it. So, very often I'll if they're open to bioidentical hormones, then I will start, let's start working on some of this because this is going to help some of the symptoms. And then we need to start working on nutritional support and things like that too. And the two together make just such a world of difference within weeks.
Just speaking of estrogen, as I went into brain fog and you mentioned estrogen, that was something new to me when I was listening to a Dutch podcast this week, actually, their weekly podcast. And it was speaking about, how the brain function with estrogen, many are not, they don't tie the brain fog and the effect of what we think are losing our thoughts or the varying reasons why they think they go awry with why that's happening, and they don't really tie it into estrogen. Would that be fair?
Yeah, very often.
Let's see here. I'm gonna kind of flip it on over to so this is such a favorite topic for me, and it's the intermittent fasting and hormones. So I say favorite because I like the intermittent fasting. It makes me feel good. However, like many, I'm told from some, you're a woman of a certain age and fasting is not for everyone. Or rather, even going to the level of ketogenic diet, where you're turning yourself into a fat burner versus a sugar burner. So the ketones versus the glucose. Do you think that women going through post or menopause, it's beneficial for them to go through intermittent fasting? Or yes or no, and why or why not?
It depends. It always depends.
Okay.
So it depends honestly on their cortisol, and if things are already dysregulated or if they're running really high on cortisol already. It can be a really powerful tool, or it can create more stress on your system. So, skipping breakfast can create more problems for somebody who's already running on like high cortisol. for somebody who's not and their cortisol is more regulated, it's a great tool to use, and is just, I think it's so healthy for your body too. But you want to look like, if you're doing the fasting and you've got really steady energy and your mental clarity is good, then you're doing okay. If you're getting kind of irritable with it, if you're not sleeping good, if your cycles get disrupted, then they're not really something you want to do prolonged. You can maybe do like 12 hours overnight, 7 p.m. to 7 a.m. That's not bad, but you really have to work on fixing the cortisol, or you're just putting more stress on your body.
Would you start with testing for the cortisol before getting them into fasting?
Potentially, yes. I mean, I do test for it often. But again, some stuff is just me figuring out where they are and what's going on with them by talking to them and kind of getting a rundown on who they are, what problems they're encountering, stuff like that. The history and the physical, that kind of stuff. So.
Mm-hmm. And also someone with your expertise, which is quite well-rounded, but also when you focus on an area of hormones, there's a lot that you can figure out even without diagnostic testing that many may not be able to. Good.
Right.
So I want to go into the food. The hormone, to balance the hormones, the food you recommend, and then I'd like to lead into the fasting, whether it be intermittent fasting to your 3-day fast that you just recently completed, right?
Yeah.
Okay. So let's start with, food as the hormonal operating system.
Yeah. So protein, super important. And we just, like as humans, we just don't get enough of it. And I think that's just, that whole food pyramid and stuff that society created, it's just not healthy. I try and tell people all the time, protein needs to be one of the first things you're doing in the morning, 25 to 30 grams of protein in the morning, because that's going to set the tone for your metabolism for the day. If you're heavy on carbs in the day, you're going to have insulin spikes, glucose spikes, and you're going to be on this roller coaster all day. Or I'm hungry. Okay, I'm better. I'm hungry. I'm better. And you're not going to be level. If you do some protein and some healthy fats early on, keeps you so much more level throughout the day. And so I tell people 25, 30 grams of protein with each meal, super important. And then, you're talking whole foods and healthy foods, fruits and vegetables, and you try and stay away from processed foods, because there's so much, you could go into a whole other topic on this, just with all the oils that are in our foods. And, there's so many things, that chemicals and stuff that just were not there 30, 40 years ago that are now. And it just disrupts everything. I mean, it messes up your gut, disrupts your endocrine system, messes up your hormones. It messes everything up. So super important, protein, healthy fats, fruits and veggies, and try and stick to as much whole foods as you can and away from processed foods.
Now we could have a whole separate lengthy podcast regarding seed oils.
Oh my gosh, yeah.
Over the years, I've talked about just the term seed oils or trans fats or hydrogenated oils, which just goes right over many people's heads.
Right.
But I'm going to throw Whole Foods under the bus here because anyone who knows me thinks that I'm the biggest fan of Whole Foods, but I had asked in 2014, we are now 12 years later, I had asked, when are you going to take the canola oil out of the prepared foods? It was supposedly in a year. Okay, fast forward, where now everything has oil in it, olive oil, but it's still, a vegetable is a great vegetable, sweet potato is a great sweet potato. You don't need to add anything to it. It's just delicious on its own. But nonetheless, they're working on it. It's just more, even the inflammatory challenges that come with these seed oils, and having people just change the dressings. I try to get my family to just try this dressing, even the Primal Kitchen, even because it's avocado oil, it's shelf stable. I'd prefer, something that is refrigerated, but grab it, find it on sale, choose the 8 different flavors, start there, because we tend to put dressings in on everything. Marinades and
Right.
dressings on everything. So I had to, shout out Whole Foods for, they need to come around. They need to get better on this. Okay.
Yes.
So, now let's just roll into the fasting. This can speak as long as you would like. So when it comes to intermittent fasting, I'll start there, and then I'm going to set this from the beginning. I'm going to start with intermittent fasting, go into your preferred fasting protocols, the length of time, 1, 2, or 3 day, and then specifically with the fasting in autophagy. Let's just scratch all that. Let's start with your preferred fasting start, your intermittent fasting start.
Yeah. So, I love food. Let's start there.
Oh, welcome to my world.
I love food. So I don't do a whole lot of the 16-hour, 8-hour kind of fasting. Truly, I'll do 12 or 14, but I like food. So I want breakfast, but I'm doing, protein for breakfast and, something healthy fat typically for breakfast is what I'm doing. And so, but every now and then I'll do what I did just every other month or so, I'll do a 72-hour fast, which the first 24 hours are often a little bit rougher, but by the time I get to that third day, you just feel so good. And so I'm like, do I keep going? No, I really want to eat food. I love food. So I get to that third day and I'm just like, oh, I really just want food, but not because I'm hungry, but just because I like food.
That's fair.
So I tend to do just 12 or 14 hours normally. And that's just truly, I just like food. So
I will support you in that all day long. I'm a girl who eats. Quite often I can't stop eating, and that's just the way it goes. So at times, there are many who would say you're going to fast or you're going to go on a 3-day fast, whether it's intermittent or 3-day fast, and then you just binge because you've been fasting. You like to gradually bring people in with the bone broth, right? And what are the things that you recommend?
You're just completely destroying what you just did if you immediately go eat pizza and tacos. The benefits that you just did in a 72-hour fast, you're completely, because at the end of a 72-hour fast, everything in your body is so sensitive. Your insulin's very sensitive, just your metabolism is so sensitive to whatever it is that you put in next. So most of the time after 72 hours and I'm starting to eat again, the first 24 hours, just protein and healthy fat. And that is it. No carbs at all. I will do bone broth to start initially because I'm just putting something gentle in my system. I'll do a little bit of avocado, and you kind of just see how your system responds to everything. So soft things typically is what I do first, and protein and fat. That's where I start. And then I'll have protein and fat throughout the day. And then the next day I'll bring in carbs, but they're healthy carbs. So I'm bringing in veggies, I'm bringing in fruits. I'm doing that kind of stuff to bring those things back into my body, and help it maintain some of the benefit that I just put it through.
Would you be a proponent of a ketogenic diet?
For some patients, yes. I think it's really beneficial for Alzheimer's patients. Mm-hmm. There's patients like that, diabetics could benefit from that a little bit more. I mean, you have to be careful with that because, if they're already diabetic, you have to watch as you're transitioning through that so their sugars don't drop too low. Initially, you have to kind of get them stable. But there's several different types of patients that would really benefit from being more ketogenic than just a regular normal diet.
So for women 40s and 50s going through their life cycles, is there something to what people are saying that, this type, a ketogenic diet is beneficial more for men than it is for women? Is there something part two?
Yeah, I mean, the men don't have the hormones involved like we do. I mean, our hormones can be all over the place, and that will totally change how our body is responding to what we're bringing in. And so you can't, it's not always the best thing, just like intermittent fasting isn't always the best thing for women because it just depends on our hormones and where we are in our cycle and things like that. So, yes and no. when you do stuff like that, you kind of need a little bit of knowledge about it and kind of what's going on already with your body and what would benefit and what would harm. So yes and yes, no.
Fair. So there are reasons where people are suggesting that women, because of our hormones, need to be careful when they're, even fasting or a ketogenic diet. I choose not to actually kind of put a name and categorize a specific diet. I personally am a big fan of, low carb, but also allowing the autophagy in little ways, with the intermittent fasting, and trying to have like 2 meals a day if I could just stick with 2 meals and no snacking. So why is it though that women and the hormones, why are the hormones affecting, are women better eating a different diet because of our hormones than what would we be, scratch this, what would be your suggested diet plan for somebody who is going through hormonal changes, a woman that is looking to lose weight?
I tend to look, we talk about whole foods and getting rid of processed foods. Mm-hmm. That's super important. And then making the things I tell people all the time is pair your protein with your carbs. So don't just eat carbs by themselves, because that's going to spike your insulin and your glucose and throws everything off. So always pair either a fat or a protein with your carbs. Helps. Just doing stuff like that, simple stuff, will level out your blood sugar and your insulin, and you'll start losing weight just with that. So it's even just simple changes like that. You don't even have to get into super long fasting, but making sure that you're not having any naked carbs, no naked carbs.
Carbs.
Yep, and that makes a difference to your metabolism and how your body is, whether it's storing fat or allowing you to use up the stores that you have.
So no naked carbs always with a protein, hence
or fat.
Or fat.
Healthy fat. Something with it that essentially it's going to give your body a little more that it's got to digest, so that it doesn't just go at the carbs, turn them into sugar, and then your sugar goes up, your insulin goes up. You put something else with it that makes it a little harder for your body to digest, and your insulin and your glucose aren't going to spike up.
Speaking of insulin resistance, do you go in just with diet? Like when you say insulin resistance to your patients, is it understood what you're speaking about? Or could you explain insulin resistance?
Yes. So, as we go along, as we get older, our cells become less sensitive to insulin and glucose. So, you're making glucose, your body's responding by creating insulin, but it's not necessarily able to bind that, use it up, metabolize it. Sometimes things are just getting stored because your body's not sensitive to the insulin anymore. And so it's just taking the glucose and storing it as fat rather than breaking it down, metabolizing it, and using it. So you wind up gaining weight because your body the receptors just aren't working the same anymore.
I like that. Appreciate that. And when you give that little bit of that insight, does it help motivate your patients to do a little bit better or focus on their diet a little bit more?
Some. I don't know how much the science helps all the time, just, depends on if they're really wanting to know what's happening underneath or not. Some people will do, some people just want to know, how do I fix it? How do I change it?
Okay. So can you at least give me an insight as to who would you have as your preferred patient, what age group, and how do they find you?
Yeah, so women typically 30s to 50s, because that's when you're getting into the perimenopause, menopause stuff, and everything's changing. And we can make changes in your diet, and we can make changes with hormones if we need to, sometimes just supplements. It depends. Everybody's different, but that's when we can make lots of changes to keep you more stable and kind of ease into midlife rather than like crash and burn. So I like working with women typically in between their 30s and 50s. And then easiest way to find me is just my website, which is Women's Hormones MD. That's the easiest way to find me.
Excellent.